Nurse practitioners, you need a backup plan. There is a very high probability that you will become burned out as a nurse practitioner if you have not already felt burned out. When you think about the career path as a nurse practitioner, there are many things that can cause us to be burned out. The modern healthcare system is pushing us to see more patients, sicker patients, in a less amount of time. You likely feel frustrated with the increasing health insurance regulations that we have to deal with. You might also have frustrations with managing some patients' care. And then you also can think about the lack of salary that nurse practitioners face, lack of bonuses, just the frustrations with not being paid adequately for our time and expertise. One of the other things a lot of nurse practitioners face as far as burnout is a lack of work-life balance. Many nurse practitioners struggle with charting, so they end up staying late at the office or bringing their charts home just to catch up. And this can definitely cause a lack of work-life balance and puts us at huge risk for nurse practitioner burnout. So if you have experienced nurse practitioner burnout, you know exactly what I'm talking about. If you have not yet, now is the time to create that backup plan so that you have a way out of the burnout. And what do I mean by this? So if you are feeling burned out, frustrated in your job, and you are wanting to leave, you either need to have the financial freedom in order for you to survive off of your savings and investments, or have a backup career if you choose to leave healthcare altogether. I have had several instances in my professional and personal life of professionals in their late 50s, early 60s who are feeling burned out in their job. They are not being adequately compensated for their expertise. They are wanting to leave that job, but feel stuck because they are reliant on that income. And some of these professionals have left that job and found a new job only to feel burned out again. Other professionals have stayed in that job and are miserable going to work every day at a job that they hate. So I don't want this for you, nurse practitioner. I want you to have that financial freedom or that backup career path in order to have a way out of the burnout. Another thing that we think about is the fulfillment or impact that you are making as a nurse practitioner. For the above mentioned reasons why the modern healthcare system is burning out nurse practitioners, it can feel very hard to know that you are making an impact and have that fulfillment in your nurse practitioner career. One other way that you can offset that is having a alternate career path that will help you to gain that fulfillment and know that you're making an impact in the world outside of the frustrations of the modern healthcare system. So, as the NP business coach, I help nurse practitioners to start or scale a side hustle that creates more impact and income than their full-time nurse practitioner job. And if you can start this side hustle now, you will have the financial freedom and the backup career to fall back on for when you start to feel burned out. You will have that backup plan in place. You will have something that you can do in order to provide for yourself and your family without having to stay stuck in a job that you hate. Make sure to check the resources below for more information on how to start your side hustle or how to scale a side hustle that you have already started. And make sure to follow me on Instagram for free business tips. So, nurse practitioners, I hope you take note of this and build your backup plan through a side hustle so that you can create that financial freedom and have a backup career path in place.